Hi, I'm Lynn, the Infant Feeding and Lactation Nurse Specialist here in Sligo University Hospital. I'm here to help you plan your baby's feeding journey during your pregnancy and following the birth to ensure you have the skills, confidence and support to breastfeed your newborn successfully. Breastfeeding is the best start you can give your baby in life. Any amount of breastfeeding has a positive effect. The longer you breastfeed, the longer the protection lasts and the greater the benefits. You will soon learn your baby's hunger cues. They will flutter their eyes, stick out their tongue, bring their hands to their mouth, make mouth movements and wriggle or move towards your breast. Crying is a late feeding cue. There are various ways you can position your baby to breastfeed. No one way is best. The right way is what works best for you. Having a baby who attaches well to the breast can prevent many breastfeeding problems. Therefore, it is worth spending time getting it right from the beginning. You need to bring your baby close and facing the breast directly, with their nose level to your nipple, tummy to mummy. It is uncomfortable and tricky for your baby if their head is twisted, so keep their head and body in a straight line. Avoid holding the back of your baby's head. You can support your baby's neck and back with your forearm. Gently brush your baby's mouth with the underside of your areola, the dark part around your nipple. Your baby should respond by opening their mouth wide with their tongue coming forward over their lower gum. Quickly bring your baby to the breast with your nipple aimed at the roof of their mouth. Baby's chin should touch your breast first on your areola, well down from the nipple. The wider their mouth is open, the deeper the latch should be. Your nipple and a large part of your breast should now be in your baby's mouth. Your nipple should be far back at the soft palate of your baby's mouth. If your baby only takes the nipple into their mouth without a good mouthful of breast, they won't be able to feed effectively and it will probably hurt. Your baby's cheeks will be full and rounded and they should begin to feed. You will start to see your baby suck and swallow rhythmically. Now try to relax back, bringing your shoulders down. This will help your letdown reflex and promote your comfort. You may feel some discomfort and sensitivity in the early days as your baby attaches, but as the milk starts to flow, this will settle. If your breasts are engorged, it can be difficult to latch your baby. Massage and a little expressing before offering the breast can soften the area, making it easier for the baby to attach. Sore, grazed or cracked nipples usually mean your baby is not attached properly and has caused some damage. A poorly attached baby may not be able to drain your breast fully, which may affect your supply and lead to an unsatisfied baby. If you notice your baby's cheeks are hollow as they suck, clicking sounds, they keep slipping on and off the breast, or that it hurts while feeding, you need to take your baby off and reattach and possibly change their position. To do this, place a clean finger in the corner of your baby's mouth between the gums and break the suction and release your nipple. Because breast milk is designed perfectly for your baby, it is quickly and easily digested. Feeding frequently in the early days and weeks helps make sure that your baby is getting enough milk and that your body is making the right amount of milk. Feed your baby as often as they want, for as long as they want. This is called responsive feeding. It is common for newborns to feed at least 8 to 12 times in a 24-hour period, including during the night. This means you will be feeding every 2 to 3 hours, which in the beginning can feel like you are doing nothing but feeding. But gradually, you and your baby will get into a pattern and it'll settle down. It is a good idea to offer both breasts at each feed to ensure baby gets an adequate amount. The length of a breastfeed will be determined by your baby's interest and response. Allow them to actively feed for 10 to 20 minutes on one breast. After this time, the milk flow normally decreases and your baby will lose interest or doze. After a burp, a nappy change or a cuddle, offer them the other breast. Then, at the next feed, reverse this order, offering the breast last fed on first. Many newborns have periods where they feed very frequently for a few hours. Often, these cluster feeding periods are followed by a longer period of sleep. If your baby is extra sleepy, you may need to wake them to ensure they get the milk they need. It is good to remember that feeds are not just for nutrition, but also give comfort and reassurance to you and your baby. It is normal for mums to worry about whether the baby is getting enough milk, and it may take a little while before you feel confident they are getting what they need. We can't measure how much the baby is getting, but even in the first week, there are some reliable signs that your baby is getting enough. Put simply, what goes in must come out, meaning their nappies can reassure us that baby is feeding well by noting how much and how often your baby wees or poos. After 5 days, your baby should be having at least 5 wet nappies per day, and the urine should be clear in colour. Their poos should be regular, soft, and a yellow mustard colour, about the size of the palm of their hand. Observe your baby during feeding. They should start with a few rapid sucks, followed by more long rhythmical sucks and swallows with occasional pauses. You can hear and see them swallowing. Their cheeks stay round, not hollow, during sucking, and they seem calm and relaxed during feeding. When finished, they will come off the breast themselves and their mouths look moist. You should notice your breasts feel softer and your nipples look unchanged, not flattened or pinched or discoloured. Additionally, well-fed babies will be alert with good muscle tone and have a good colour and look like they fit in their skin. After 10 to 14 days, they will start to gain weight and their clothes will become snugger. They will have some content times during feeds, but fussy periods are normal baby behaviour too, and not necessarily a sign of a baby who is not getting enough milk.